Okay, good morning class. Let us start with the topic which I am going to teach, that is nursing process. Okay, have you heard about this term nursing process? Anyone? Nursing process is nothing but when you start giving care to the patient, we follow some systematic way of giving the care. It is called as process. Process means some systematic way you are moving, okay, from simple to complex or from known to unknown so that you can give a better care to the patient. That is what is called as the process. And nursing means, all of us we know, it is the art and science which we start inculcating and develop our knowledge, develop our skill with a positive attitude so that we can implement the best care to the patient for their faster recovery, for their better evaluation, so that they can lead a healthy life like other people. Okay, so with this brief introduction, let us move to the nursing process, what it means. So you can see here, it is a critical thinking process where you think very critically with some logical reasoning, with some judgment, you start thinking. Okay, now what do you think exactly? You think about the patient problem which you are going to identify in the patient when you are there at the bedside of the patient. Yes, am I right? Okay. And you can also see in this that professional nurses, that means the nurses who have been registered, who have been qualified, yes, after doing the course. So they are the professional nurses who follows the professional code of conduct, follows the ethical aspects of the nursing. So we are all professional nurses used to apply the best available evidence to caregiving and promoting human functions and responses to health and illnesses, which has been given by American Nurses Association 2010. So what it is talking about, that whenever we give care by doing a logical thinking, critical thinking, we are using our evidence based. Evidence based means what? With some proof. Okay, evidence based caregiving. We are using certain evidence based practices, evidence based ideas, concepts, okay, while we are applying the care to the patient and promoting the human functions. Human functions is what? It is the physiological functions of the body. It is the physical appearance or aspects of the body. It is the social aspects. It is the spiritual aspects. So, whenever we give care to the patient with the evidence-based care giving process, we are giving the care in a holistic approach. In totality. Holistic means it is in totality. So we are not giving care only to the specific condition because of which the patient is admitted, but we are also taking care of the patient from the physical, physiological, social and spiritual aspect of the patient. Okay, so that we have to keep in mind. Just don't give mechanical care to the patient or like a robotic care to the patient. We also should have a human touch when we give care to the patient. Like communication, you communicate with the patient when you give care. You don't keep yourself mum and just do something robotically, and patient will be feeling maybe what is happening, no one has explained to me what you are going to do, how it is going to be benefited for the patient. All these things are not been told. You have just come to the patient bedside and you started giving the care. So that is not the thing. You have to take care of the patient in an holistic approach with the human touch. That is what is the communication, understanding the patient, empathy for the patient, as well as for the family, from which family the patient belongs. That is also very important. Okay, so you should also take care of the patient's family along with the patient whom you are giving care in the hospital. Okay, and that is how you can see that human functions and responses to the health and illnesses. The more you take care of the human functions in a holistic manner with a human touch, the more you can see the patient is improving in a faster rate, recovery is better, and the patient is moving from the from the illness continuum to the wellness continuum of the health illness continuum. Okay, so they will start moving towards the wellness continuum. That means they are feeling better, the well-being is getting better. okay, of the patient, by the care what you have rendered to the patient with the human touch, with the holistic approach. All these things matters a lot in the patient's life, especially when they are admitted in the hospital and during their course of staying in the hospital. Is it clear to all of you? Okay. So this has been given by American Nurses Association in the year 2010. So nursing process is a systematic method providing care to the clients. Systematic method, that is what I told you in the beginning. It is a process. Systematically you go. Like for example, whenever you come to the patient's bedside, you first ask to the patient after wishing the patient, है ना? You wish the patient good morning, good afternoon, and you call the name of the patient. You call the patient by their name, Mr. So and so, XYZ, Mr. Ram, Mr. Sushil, Mrs. Sunita, whatever is the name of the patients, you always address the patient with the name, not with the bed number, not with the diagnosis of the patient, not with the appearance of the patient, like tall, short, fat, not like that. Even not by calling bed number 24, okay, bed number 36 who has got appendicitis, not like that. We have to call the patient by name because everybody has their own individual identity. Yes, and we also have to maintain the respect of the patient, irrespective of the caste, creed, rituals, religions, geographical background, socio-economical background. That doesn't matter when you are working as a nursing personnel in the healthcare delivery system. You should not judge. He is poor, so no need to give care. He is a free patient, no need to give care. Okay, he is a very rich patient, we must give care to that. So this kind of attitude should not be present in any healthcare professionals, whether they are nurses or doctors or paramedicals, pharmacists, whoever it is. Okay, so this we have to keep in mind. And second is what? Systematic way. That means after you wish the patient, you ask the patient, how are you? Do you ask? You have to ask when you go to the clinicals. So you ask the patient, how are you? See, they will give you so many answers that I was not fine, I was not better, I couldn't sleep yesterday night, I was having severe headache, okay, or I was having body pain, I was not getting sleep in the night. So many things they will tell. Okay, so these are what you have to listen very collectively with your sympathetic ear. So you should be a good listener, you should be a good observer rather than keeping or placing your own thoughts first to the patient. So first you listen, at the same time you keep observing the patient's gestures and postures. You know, when you are very happy, you express something in a very happy mood, which reflects on your face. Yes or no? Your face looks very bright, it looks very charming, your face will be very smiling, and you will be very active with your, gestures and postures when you tell something good news or if you are very happy. Same way, when the patient is feeling sick, weak, sad, pain, agony, they will not show all these happy gestures. So they will be grimace, their face will look dull, is it not? And they will have restricted movements and activities, maybe because of pain or surgery or some kind of, deformities are there, paralysis is there, because of which the patient is unable to move. So you find that whenever the patient is telling their own problems, it also gets matched and reflected on their gestures and postures. They will look very sad. Okay, so this is what is your subjective data. You are collecting the data based on the patient's verbatim. Verbatim means what? Whatever the patient is telling, you are listening and you are collecting those datas. Datas are nothing but the facts and the figures what you collect in two methods. One is your subjective method, another is your objective method. So subjective method is based on the history what has been written in the patient's file, or it may be the patient's verbatim, or it may be you have collected some histories from the patient's family members, caregivers, social workers who are very close with the patient, from them you have collected some data. So that is what is called as subjective data. Now based on the subjective data, you cannot always find the nursing diagnosis or the problem to be identified, because subjective data will not give you the evidences, that means proof. Suppose you told that I am having headache. It's a subjective data. How I will understand you are having headache? There is no proof. You can't make out from the outside that the person is having headache. So you have to collect side by side objective data. So objective data are what? These are also the facts and figures which you are collecting based on the evidence which you are seeing or getting reflected in the patient's body. You understand? For example, anemia. You have seen in the investigation report, this is also one of the objective data. Okay, that patient has got hemoglobin is maybe 8.5 grams percentage or 7 grams percentage, like that. Okay, so further you want to check, as per the your investigation, you want to check the objective data apart from this objective data for the patient's body. So what you do in the physical examination, you check the nail beds of the patients, you check the capillary refill of the patients, okay, you check the tongue of the patient, which will be very pale, okay, lips will be very pale, conjunctiva you have to check, which will be very pale, it will be not red in color. And also you may find that the patient is having some sort of breathing difficulty when they do the activities, if it is a severe anemia. Yes or no? Because we know that the body is having blood and the blood is consisting of RBCs, and they are also having oxygen and nutrients which get supplied by the RBCs to the different parts of the bodies for the growth and development of cells and tissues. So if RBCs are less, then oxygen consumptions also will be less, nutrients also will be less in the body, and because of which the patient will feel exhausted or tired, you know, whenever they will do some kinds of activities. So that is what is again a major symptom which is showing that as an objective data, patient is having anemia. You understand? So this is what, but patient will come to you by telling that I'm feeling very tired every time, I feel breathing difficulty whenever I do some kind of work. This will be the subjective data, but there is no proof of all these things. So to get it proved valid, you need to have some evidence based data which we collect in the form of objective data. So objective data are collected based on the physical examinations, based on the clinical features what has been reflected on the patient's body, and third is the investigations. Okay, so what are the different investigations in the broader heading? We have invasive procedures as an investigation and we have non-invasive procedures as an investigation. So invasive means what? Where you need to do some invasive things like you cut or you inject or you know something which is called as where you need some surgical measures to conduct the procedure. Whereas in case of non-invasive, you don't require all these kind of things. Is it not? Like for example, you take the temperature of the patient. This is also a procedure, evidence-based procedure. You are seeing that patient's body is very hot. So you are using a thermometer and you are checking the temperature. So this is a non-invasive procedure. Clear? But suppose you want to do some X-ray, is a non-invasive procedure. But you want to do suppose maybe a CT scan or something where you have to inject the radio opaque dye. So you are doing the catheterization and you are injecting. So these are the procedures, or lumbar puncture or bone marrow aspiration. These are the invasive procedures. Clear to all of you? So this is what is the main thing, what actually the systematic method of providing the care consisting of. Next is the nursing process is a systematic method of planning and providing individualized nursing care. Now here the main catchword is individualized nursing care. What care you are providing to one patient, that same type of care may not be provided to the other patient, even if both of them are having the same diagnosis and same problem. You understand what I mean to say? Because our body responds in different way. Everyone's body doesn't respond to the same drug in the same way. Okay, so that is why there are some individualized differences are there in the physical, in the physiological aspects. Like for example, there is a patient, there are two patients, both of them are running with 102 degree Fahrenheit temperature. Okay, and you know the procedures of nursing care that if there is a temperature of this much, then you have to go for cold sponge, tap sponge, cold compress, and even if it doesn't get subsided, then you go for paracetamol to give to the patient. Now suppose you have given one paracetamol to both the patients after doing all these nursing procedures, and you have waited for some time, and then you have checked the temperature again. Maybe after half an hour to 40 minutes you have checked the temperature. But you could find now that the patient Ramesh, whose temperature was 102, has been subsided to 100 degree Fahrenheit. Whereas the another patient, Mr. Suresh, the temperature has not been subsided. It remains the same even after 40 minutes, maybe 102 degree Fahrenheit. That means what? The body responded differently for the same type of drug and for the same type of symptoms. So no need to worry. You have to give one more paracetamol to Mr. Suresh. Yes, so here what happens, because of this you will find after some time again when you check the temperature,